Chief Executive Officer for the Well-Being Trust. He's going to speak about building healthy communities for impact at scale. Tyler.
Thank you so much, Holly. You're so dear.
Okay, go ahead.
Good morning. I grew up in the mountain west of the United States, and the Shoshone people on whose land we are used to teach us that it is good that we are here together. It is good that we listen and that we learn and that we lead together. We're better together, wiser together, and we need each other as we deepen our own healing journeys. They'd say it was good that we remember that whatever may divide us, that which connects us is greater still. And it is good that you're here. It matters that you are here to bring your lived experience, your trauma, your losses, your grief, as well as your joys and your celebrations and the gifts that you have. Not only because that is what we need to be able to lead effectively, but that's what all of us are needing in our own healing journey. It matters. I stand before you as the CEO of a large national philanthropy with a mission to advance the mental, social, and spiritual health of the United States. And I'm going to talk about that in a minute. But it wasn't always looking so promising. At 14, struggling with some significant family issues and substance misuse, my friends and I finally got arrested and found ourselves on our way to jail for what was hurting us and hurting our community. And it was in a small rural community, and I remember the community meeting really well with the principal and the police chief and all the community members there, our parents. It was the most shameful moment of my life. Well, among them, I had a few. And the principal of the school stood up in front of the community and said, any kids that would do this to this school and this community need this school and this community. And we didn't go off to reform school, and we weren't sent to jail, and it took us 2.5 years to pay back the damage of the vandalism that we did, to make restitution, to reconcile ourselves with our communities. And at the end of that, our records were expunged for the felonies we committed. And we went to college, and I stand before you here because community saved my life. So I want to talk with you about community. But I also had another role here, which is to reflect a few themes. So I'll get there, and I'm going to talk about well-being, trust, and what we're doing in the United States. But it was part of my role to share what is it we've said. And I'm humbled by that because I recognize that my listening comes from my own culture, my own experience, and so what I'm sharing back is what I've heard, and I want to make sure that you recognize that I'm not trying to slight anything, but rather just respect that it may not come out exactly as said. So the first of these 5 points, if I may say, that I really took away, and that some of you helped me say, is that we've got to change the narrative and the narrators, right? And if we start by changing whose voices are at the table, the narrative will naturally occur. And if we have a conversation of possibility driven by people from their lived experience, their trauma, their youth, their elderness, their inclusion, their exclusion, we will have a conversation of possibility that is rooted in inclusion that actually has the possibility to change something significant. As was said this morning, what's the change that needs to happen in 50 years? She said, I am the change. Right? Yesterday, Tenshai said, darling, in her poem. I love this. She said, darling, you matter. That's how we change the narrative and the narrators. The second big takeaway from me was practice radical inclusion. We've talked so much about co-production of health, how much our fates are bound up in one another. This exquisite mutuality, this braid, this weave that we know we are as a human family. Back to what this the Shoshone, the people of the tall grass, would say. What connects us is greater still. A mentor of mine used to say, we need to, in this practice of radical inclusion, practice respect. What does that word mean? It means to look again. Respect. I might look at you and think I know something, but it's my job to actually go, who is this man? Who is this woman? Who are they that I may not understand? And practice that as the heart in order to understand why it matters that everyone has a right to sit at the table and make it so. The third is an absolute, that mental health and disability rights are human rights. That everyone has a right to health, and there is no health without mental health and no health without disability rights. That is our job to practice that at root. Fourthly, the three co's: community, collaboration, and co-benefit. One of my early mentors was the developer James Rouse. He said, a healthy community is a garden to grow people in. Community's close to home. It's most relevant. It's where our culture is. It's where the assets lay. It's where the joy is. It's what's within reach. It's what we can do something about. It's what everybody has the possibility of actually doing something. It's where our habitat is. Secondly, the collaboration element of this. We talk about collaboration, but we usually practice cooperation and coordination. Collaboration means we use our resources differently. You want to know whether collaboration is happening is, are we spending the money differently? Are we hiring differently? Are we doing things in a different way? Not just trading notes. And finally, co-benefit. A good solution solves many problems, right? When we create affordable housing with wraparound services that supports people of all abilities and life experiences, we heal, we create opportunities for food and for mentoring and for caring for the kids and caring for the elders, and we create the base for a healthy economy, right? Win, win, win. That's what we need to be able to practice. And finally, the big lesson was around leadership, right? Leadership's about power. Who's at the table? How are the issues framed? How does the discourse occur that sets priorities? And how are the resources allocated? That's what our job is of leadership, particularly those of us with privilege, to ensure that that actually happens in a different way, right? And to be boundary-crossing leaders, not only on the acute side of people having need in the times of crisis, but upstream on how the conditions are in the first place. T-minus 9 months in the womb, all the way to end of life. In our neighborhoods to global. The boundary-crossing leadership across political party, across generation, across geography. That trans leadership is what we are needing, right? So, those are the reflections I heard. My daughter is 26, right? She's the age of many of these young people that are in front of us. And she's been alive through much of my work in my place of service. And so, like a good daughter should, she brings home this report last year that says, Dad, you've been working to create healthy communities my entire life. And my reading here is that for the last 120-some years, lifespan has increased almost 24, 25 years. But you've been working on this my entire life, and now lifespans have decreased in the United States by the last 3 years. What have you been doing? Right? What have we been doing? on our watch. Right? That is where we begin. So in the United States, we know these are individual factors. Our loneliness, our isolation, our lack of belonging in a fragmented care delivery system that doesn't know how to look at the whole person or embrace it, in community conditions that routinely exclude by race, by gender, by geography, by walk of life, right? No wonder we have the diseases and deaths of despair. And no wonder we have outcomes that reflect the lack of systemic work. I will say that once you know that the work you're doing isn't producing outcomes, it's actually unethical to continue doing it the same way. And so here's our opportunity. Wellbeing Trust with the Robert Wood Johnson Foundation released a report a couple years ago called Pain in the Nation, chronicling the diseases and deaths of despair, alcohol, opioids, and suicide. But more importantly, it put forward evidence-based strategies at a call for a national resilience strategy, rooted in what do we know about loneliness and belonging and the isolation and the despair that is underneath so much of this, and these rates that have doubled in the last decade and are slated to double again, as you see on this map, if we don't do something about it. What are these massively entangled forces that are landing us where we are, and how do we understand them? From climate to addiction to our economy to economic inclusion to those who are experiencing homelessness. How do we sort of get our arms around this in a systemic way that we can do something that will actually add up? And what are the leverage points that can have the most promise? And what as leaders shall we actually advance that could take us there? So we're taking a systemic approach to this. Not only on the top bar saying, how do we shift our organizational practices? Because this means every one of us. How do we shift our organizational practices, our public policies, and our uses of private capital and capital markets to have enough dose, right? Reach, intensity, and duration to have a population level impact. But that means we've got to change our relationship and the very power dynamics I was reflecting earlier, which means we need to change how we're thinking, right? That's really the opportunity that's before us. So Wellbeing Trust was born just 3 years ago. The gift of the Providence St. Joseph Health System and its sponsors with the mission to advance the mental, social, and spiritual health of the country. And our target, our big, hairy, audacious goal, if you will, is to save 100,000 lives in this country from diseases and deaths of despair. Now, most of the time I sleep pretty well, but when I wake up in the middle of the night, my question is what we're doing with all of our partners, not just our little foundation, capable of actually moving that needle, right? Actually capable of that. And who am I as a leader? Who are you as a leader? What is it asking us, like the young people said, to step up so differently? So here's what we're doing. Number one, we've got to get the care right. Second, we've got to increase access to that care. And third, we need to create healthy communities in the first place that create intergenerational well-being. So get the care right. Integrated, whole person care, no wrong door. Right? Spirit, mind, body, all in. That's the job of the healthcare sector, and it's hygiene. It has to be done. And we have a long ways to go. Secondly, we need to pay for access to that care in the United States. So Wellbeing Trust is committed to playing a convening role, to lead by inclusion of core mental health organizations, civic organizations, youth and senior organizations, grassroots community organizations, people without titles after their names, to actually lead. To leverage our philanthropic resources to trigger others to invest in a meaningful way and move government resources by de-risking strategies such that the public dollars can be spent in a meaningful way and link people and localize the work back in communities. So with our partners Civitas and others that I'll show you in a minute, our goal by bringing this movement together is to help lift up federal policy agenda and by targeting in a few ripe states that are ready to actually shift public policy in a way that is capable of impacting health in the way we describe. So we're working with the key partners in a place of convening to bring their leadership, their knowledge, their Hill relationships, their constituencies together in a meaningful way that is capable of creating change. And rooting that, not just in the Washington-based organizations, but in the natural transpartisanship of America's communities, rural and urban, in the pragmatism of communities whose goal is to just get stuff done, right? The practical stuff. That's not Republican, that's not Democrat, that's not the food fight we saw last night. That's actually what we do to come together, to do what we know we need to do, so that we are capable of creating a policy agenda that gets moved and the resources moved so that we can actually improve health. But thirdly, even if we get the care right, and even if we ensure that people have access to that care through the policy to pay for meaningful access to that care, affordable access to that care, we've got to address what creates the conditions in our communities in the first place that give rise to intergenerational well-being. We've got to meet basic needs for health and safety. We need to make sure that from early childhood all the way through end of life, we're creating opportunities for people to learn and grow and expand in our education systems and pay for teachers, and is all part of our learning agenda. We need to make sure that people have a living wage that allows them to support their family. Of course, we're talking in this room about serious mental illness, and we're also talking about increased rates of anxiety and depression and suicidal ideation and substance misuse. We shouldn't be surprised given the struggle that people have to actually make ends meet and raise their family in a way. We need affordable housing that is humane and safe, that creates safe places to actually live and be. A vibrant natural environment that are places to be in nature and learn from nature, as our elders were talking about yet this morning, and that address the environmental justice and toxic issues that belabor many of our communities of color. Reliable transportation to get us to work and school, and civic muscle, particularly in this democracy where our grassroots leadership and our local leadership is capable of bringing our might as citizens to bear in a radically inclusive way and building a portfolio around that. So we're building a national alliance, not only a policy front for mental health care, but around these co-benefit strategies that are part of that, and we ask that you join us in this. So that's what Wellbeing Trust is up to, not just as a foundation, but as a new national foundation informed by an advisory council and by the nation on what should we be. When the sisters made a $1 billion commitment in this mission that we're part of, they humbly said, what is your community strategy to deliver it? They also said, what's your strategy for LGBTQ? What's your strategy for radical inclusion? These women religious that gave this money and moved the money into this mission said, we want to see a strategy of radical inclusion that is rooted in the well-being of the most vulnerable among us. So in order to deepen that conversation, let's move into the questions. Just as Brian said, you have a prompt, hopefully is up on your app, and if not, begin the conversation at the table. You've got the questions here. Please turn to one another and begin on these two questions. What is required for you as a leader to have a wider, deeper impact on well-being and inclusion in your community or your organization or nation, depending on your level? And who are the partners and stakeholders in helping achieve that you need to engage? Please begin. Thank you. We'd like to bring the conversation from your table to the whole room. So we have mics here. If people individually or somebody on behalf of your table would like to come to the mic, we'd love to hear the reflections from your table. So who'd like to kick it off? Excellent. Okay, setting the stage. there you go. And then if others want to line up, so we're ready to hear in the next 15 minutes, we'd love to hear you. Please, Phil.
We got involved in this by recognizing that what we need as leaders is everybody else, because it's not us that does it. It is the way we relate to and work with people around us, both in relationality and in listening, that enables us to take a lead. We recognize that there is something about consistency of leadership, and mobility often militates against getting things done because it doesn't allow for the consistency and persistence that is required to move forward. We felt that there was a role for national and regional government in making space for this to happen, not space physically, but space conceptually, into which local leaders can move and begin to take things forward within their own communities. We talked about our need to involve everybody in communities, particularly intergenerationally. It isn't one or the other, and often what we do is we lurch from one group to another one, from the young to the old. What we need to do is to bring people together so that all can benefit from it, and they can help each other's leadership to achieve some things in what we need to put in place. Was there anything else we mentioned that I've forgotten? Oh, healthy cities we mentioned as being a key aspect of this, because what the healthy city movements do under the banner of Thrive often is to enable social movements to occur that look at community strengths and abilities to make the solutions for themselves, with leadership enabling them to achieve that.
Well said. Thank you so much. Beautiful. These are quite working in, so Dan, I guess you get me next to you.
It's okay.
That's all I got.
It's like an interview.
That's it. Please. Dr. Thompson. Okay, thank you.
Does that work? Okay. So at our small table, we discussed this issue, and I guess the first question is, what would be required for you as a leader to have a wider impact? And I think the place that we came to was that it was really essential that the leaders have a story that they are going to tell about the place that they are in that is compelling as to why there needs to be a change and what that change is going to look like. So an example of this is, and a focus that we're taking, for example, in Pittsburgh, is to really focus on child poverty as a story, and how it is important that in this new city that we've created with an inclusive economy, that we are actually looking to make sure that we are not creating a generation of children and youth who are actually going to be unable to participate in that new economy. That in fact what we're looking for is the creation of a capacity for all people to make the city thrive. So in that healthy city sense. And that this is built out of the importance about this, the leader having a story, is that the story has to be perpetually, consistently told, and then told at the right moment when the crisis is happening that allows the story to move forward. And we talked about a little bit about, just as an example, Beto O'Rourke yesterday talking about the need now to actually think about how we don't actually have assault weapons, because now is the time to talk like that. So the story needs to be ready for the moment, and the leader has to be ready for that moment. It's the prepared mind is favored, and that's what we're talking about, is what a leader needs to do. In doing that work, and then the notion of relationships, I think, is critical. And what we came to with that is that it's essential that we have, as leaders moving a city or a place or a community or a population forward, is that we have diverse relationships with all of the stakeholders and resources in that community, because that's what you build out of. And it's basically the smorgasbord of what our society is made up of from government to and political parties, to business, to labor, to various different industries, to the nonprofit institutions and cultural institutions of our communities, the religious enterprises, and media, education, and the law. I mean, I could go on even, right? It is necessary, if you're going to mobilize a society, that you have everybody doing it. And I'll just stop with an example. In Pittsburgh right now, the mayor of Pittsburgh has proposed that we create a $3 billion social investment fund that will require a great deal of leadership and activity. It is a new institution and a new way of approaching the social problems of the city of Pittsburgh. We've never had it before, and you will find out, and I will find out over time as to whether or not we're able to pull it off. So,
Ken, thank you. So appreciate you calling out the role of private capital in a social investment fund, and also the need for a well-being economy that practices inclusion that works for everyone. Outside, that's essential upstream. Please.
Hi there, my name is Jill Shakespeare. I work at the Center for Addiction and Mental Health in Toronto. And I want to talk about the small ways of thinking which leaders can make an impact and ways that are actually relatively easy. So I think about my team that I lead. They're mostly young leaders themselves, and they work in a unionized environment. And there's been a lot of talk lately about climate justice. And we know Greta from Sweden is right now at the White House. And there is a lot of despair on my team around climate change. And it actually, I can see the impact on them because they're all social justice advocates. And so this one small thing I can do as their leader is to create space and permission for them to, at lunchtime, come together and organize and mobilize people in their workspace. So thinking about workspaces as communities and ways that we can engage our employees together to build community. And I actually see that as a mental health promotion intervention that's free for me to do in my workplace.
Okay, where's the one? Thank you. Who else? Please.
Hi there. My table we had New Zealand, the US, and Singapore. We had a couple of observations. When it comes to inclusivity as well as well-being, I think many of the leaders in our organizations do not focus on it because we are leaders to solve problems. And therefore, the whole perspective of this is a problem-oriented situation where leaders are called to tackle problems and not look at possibilities and opportunities. So that's a big observation that we have. We're often too reactive. We're often too focused on problems and not looking at opportunities. That's one thing.
Beautiful.
The other thing that we reflected on is the fact that as leaders, oftentimes we feel that before we can get into the meat of what we're supposed to do, we start defining and limiting things and having proper definitions. And so that's because it's in our best interest so we can deliver on what we're supposed to do as leaders. But that in itself is very damaging because oftentimes that takes a whole lot of things which are meaningful and impactful out of the equation and out of the statements that we're meant to deal with. And at the end of the day, we might be able to deliver on what we're supposed to have done, but it has little impact.
Thank you. Yes, please.
Hi, my table left, but it wasn't because of anything I said. We had a really interesting conversation, and some of it is about reframing some of the existing public dialogue. So, for example, the debate in this country around gun crime is, geez, if we could only identify those mentally ill people who are going to shoot folks, we could solve the problem. That is not the solution.
Yes.
You've got to ban weapons, you've got to change the dialogue, and we can't allow people with mental health issues to be stigmatized as the cause for such a social scourge.
Here, yes. Thank you. Thank you.
I mean, 40,000 people every year die from gun crime in this country. Like, that's 3.5 times the Twin Towers, and we're not doing much about it. So, on other fronts, we looked at, some of it is also the simple stuff, like it's how do you scale the stuff that we know already works, whether it's a population health approach. And in some cases, the innovative stuff that's happening, we had a presentation in the NASHPED group this morning about this really neat program in Chicago that is giving young homeless people cell phones and a data plan and access to free CBT, and they're seeing results. So those are little things that you can scale. I think the other thing that we need to acknowledge is, the social determinants, and as one of our colleagues talked about, the social determinators of health. So the fact that all around the world we have a housing crisis. What do we do about that? How do we engage in the dialogue? How do we leverage private capital for improving housing outcomes? Because if there's no health without mental health, there's no mental health without housing.
Brilliant. Thank you. Please, Barbara, introduce
Tyler,
yourself.
thank you, and thank you for such an inspiring talk. My name is Barbara Ritchie, and I'm with the Center for High Impact Philanthropy at University of Pennsylvania. And our table, we were talking with Danny from Australia, and he was talking about how they have universal health care. And yet in his church, they're really interested in helping those that are less privileged, and that they were able to raise a significant amount of money to help other communities, or even in their own community. But they didn't know where to give or how to give effectively. And we know at Penn that only 15% of people who give spend more than 2 hours looking at where they give. So we're releasing a guide by the end of this year on how to we frame where to give for high impact in behavioral health. So I hope you all look for that by year end and be smarter about where you're donating.
Barbara, thank you. One of the things that some of you will look forward to is the Center for High Impact Philanthropy and the Healing the Nation policy strategy that I described, as well as mental health for us, are going to be joining forces here in the U.S. to actually help build the political will to not only move private capital, but public capital towards priorities that can have an impact. So thank you. We have time for probably one or two more. I want to make sure that that the thing that hasn't been said yet finds voice.
Hi, my name is René Kiet from the Netherlands, and on our table we discussed the need to work with people more widely because we're all too much restricted in our own roles, and so what we really need, mental health is just too big a topic for mental health providers alone, so you need a target there. And talking about, so we talked about stigma, for example, and from the point of mental health providers, traditionally this was looked upon something that evil society is doing to our poor clients. But there has been a study that in fact 25% of stigma experiences are experienced within mental health care. Mm-hmm. So if we don't start to change that ourselves, how can we expect the rest of society? So we really need a network approach for that, in an interdisciplinary and intersectoral approach. And also we talked that we spend our money too late. We should have much more of a public health focus. Me as a medical doctor, maybe I had 3 hours of class on public health in my whole training to become a doctor. Whereas I know now that every euro spent in public health is going to contribute to the society much more than in just the cure of treatment. So we have a way to go, but we can do it.
Yes, thank you. So we're coming to the close of this part of the conversation, and I just want to say thank you for what was just said about this upstream public health approach, the call out to healthy cities that is suggesting that it is the conditions in our communities. We've been trying to drop the language social determinants of health. It's not playing so well in the US, and thinking more about the vital conditions for intergenerational well-being. It's the same list, but they're not just social, they're economic and environmental, and they're not just determinants, they're conditions within which we live. And so this kind of a focus, I think, gives us hope for how we create gardens to grow people in, how we create communities for human flourishing. So we got to get the care right. We've got to treat and provide the care for people who are struggling with serious mental illness and their families. We've got to make sure there's radical inclusion around people with different ability levels. And there's something that we can do to build healthy communities for all of us. Because this isn't 1 in 4 and 1 in 5. This is 1 in 1. It's all of us. So I encourage you both here in the United States to join us at Wellbeing Trust and our partners in helping build the community and political will for a policy agenda that is worthy of who we are as leaders, that is worthy of who we are as professionals, and worthy of the call from our youth, the call from my own daughter to put in our own watch something that can have a change in our countries. We've actually stepped up as the U.S. lead or coordinator for the United for Global Mental Health and are going to be part of the Speak Your Mind campaign. You're going to be seeing more invitations for that at the United Nations General Assembly and the kickoff on September 23. You'll be learning more about that, an opportunity for the world to listen to each other, to learn together and lead and build the force that we know we are capable of for a healthier people and a healthier world. Thank you so much for the leadership of IIMHL for making this conversation possible. Beautiful. Thank you, my friend. Blessing.
Thank you, Tyler. At this time, though, we are getting ready to break for lunch. And as you know, you have about 90 minutes, but I would ask that you be prompt in coming back because the best is yet to come. When you come back at 2, you can look forward to a number of wonderful things that are going to be happening here. The Indigenous Drum Group will be back. We're also going to have a Soca Tribe Caribbean vibe. We'll have also a wonderful video collage of some of you being interviewed from the events over this time frame. But probably the Fista Resistance is that we'll be introducing to you, and this isn't really any kind of folks you don't know, but a young man who's sitting right in front of us here, Mr. Fran Silvestri, will be coming up towards the end and will be introducing, as is the tradition of IIMHL, to transition to New Zealand, who will then give us more information. So enjoy your lunch, and we will look forward to everyone being here right at 2 o'clock. Thanks, folks.